I thought I'd start my piece by telling you a story. This summer I was extremely lucky to go on holiday to California, and we paid a visit while we were there to a place called Carmel Beach, which is on the coast. Beautiful place with wonderful sunset, beautiful golden sand, lots of very rich people living there. The mayor used to be Clint Eastwood. There's a magnificent golf course near called Pebble Beach, which my husband became very interested in. Unfortunately, it was £350 for a round of golf, and he actually wanted to play on the grounds that I'll never come here again, but I vetoed that because I just thought that's too much. And it was great people watching for me. So at the time I was training to do a half marathon, my second one at the age of 50. And so I went out on early morning runs to this lovely place with all these big houses, people watching for looking to see if I could spot any famous people as I was running around. And there was this car-free circular route around Carmel Beach, and there were virtually no cars. It was very difficult to take a car down there. And all these people who lived in these big houses, most of them millionaires, I should think, a lot of them came out in the early morning run period, which was about 7 a.m, a bit too early for a holiday run, and came out with their dogs. And I noticed that they did this circular route, and they stopped to talk to others as they were doing it, and most of them were on their own. And I thought, this is really interesting as I was running past, trying to go faster and faster, that all these people who seem to me to have such wonderful lives and live in such a beautiful place are so interested in this opportunity to connect with other people in a safe way. And it was very interesting to me that this walk precipitated lots of conversations with their dogs, and then they went onto the beach and they laughed, and they obviously knew each other reasonably well. But it wasn't as if they were going into a bar in town and something and meeting there. This was a much safer and much more interesting place to meet with other people and to use the opportunity to be active and connect with other people. And I really thought, yes, there's something really interesting here about the physical environment and the way that relates to the social environment. And what's happening here is that people are doing some activity and using it as an opportunity to connect with other people. And that seems to me to be the root of you hear a lot about the health, about health and the built environment. But also what's majorly important is wellness. And being active seems to me to be the cornerstone of our wellness and our mental well-being. And the physical and the social environment complement each other in how we can achieve health and how we can achieve wellness. So social places are almost as important, and the social environment is almost important to our health and wellness as physical places. So when we're thinking about designing places, we really should think about that as much as we can. And everyday activities like walking, they provide an opportunity to be active that most people can access. You know, walking or being mobile in terms of using a wheelchair or other forms of sustainable mobility. They're low impact, they're low scale, they don't require any special equipment. We can all do them. And it doesn't mean we have to walk fast or we have to wear lycra or anything awful like that. We can still access them. And that's what's so important about walking, I think, as an everyday activity. You know, it breaks that chain, it breaks that connection of the busy life and the stream of thoughts that go on with busy lives. And mental well-being and health therefore go hand in hand, I think, and they're very much connected to the built and the social environment. And being active is one of the ways that we achieve wellness, which is something even more important probably than health, or the two go hand in hand, and one leads to the other and complements each other exactly. So we should create places that help us start to think about being healthy and well, and that being something we do rather than something we are. Tools and evidence are important in this. The quest for more people walking every day, there's lots of research about how to get people walking every day, because changes to places need to be evidence-based. They shouldn't be a leap of faith. But however, creating an environment to maximise wellness and health, it is something of a no-brainer. And it is something about how we want to live as well. And that gets lost a little bit in the quest for evidence and tools and all of those things, which may seem surprising coming from someone who makes their living out of doing research. So we should make the changes for which we have the best available evidence, I think, and evaluate impact on the population as we go along. And if it isn't working, I think we change it.
Thank you. Thanks, Jane.